Good evening, sir. So, shall we start? So, you can start sharing your PPT. We'll be starting.
Yeah, sure. So we have got two active candidates today, right? So I am sharing the screen. Whoever is the active candidate, just unmute yourself and start. Yeah. Hi, doctor.
This is going to be a very interactive session. It's a request to all to kindly unmute your mics.
Yeah. So like our usual, I am like I'm visible on the screen, right? Yeah. So like our usual sessions, we shall be doing two cases today. The first case, each case will be around 20 minutes, and then we shall have a, like 15-20 minutes discussion. So the first session I think will be done by Dr. Amla. Okay. Dr. Amla, you are ready, right?
Uh, Sir, I'm ready, but I actually, I mean, I haven't yet even started any PACES preparation. Like long back, I had done almost 7 years back, and now, like I was doing anesthesia, and now I'm again restarting PACES preparation. So I mean, I don't know if I'll be able to continue for 20 minutes talk. Like, I have almost forgotten everything.
That's okay. Just give it a try, right?
Okay, sir. Yeah.
Mm. So yeah, like take around 5-6 minutes to go through it and just prepare yourself, and then we shall start.
Okay.
And there are two slides. Once we're done with this session, move to the next slide.
Hello, Miss Sochi. I am Dr. Amla, and I'm going to discuss about your latest investigation reports regarding your uh, ongoing treatment. So, how are you feeling today?
Yeah. Good morning, doctor. I'm feeling a bit better. Thank you.
Okay. So, how are things going since last few months for you?
Yeah, doctor. So since the last few months, I'm a bit down on the sun. I'm feeling a bit tired and lethargic. I'm not feeling very active. So what I did was I went to my GP, and he prescribed me some tests, blood tests and scans. And then I went back to him with the reports. He told me that he had some bad news for me, and that my function of my organs, like of the kidneys, those have gone bad because of the disease that I'm having. And so he has referred me to this clinic today.
Okay. Like, have you been taking your medications regularly till date?
Yes, every day as per the prescription, I am taking it without any miss.
Okay. As your GP has already given you some idea about the test results,
Mm-hmm.
so I'd like to elaborate on the same. So, basically, as you are already aware that you have this lupus SLE
Mm-hmm.
since about 8 years,
Yes.
so so are you aware of the have you read about the complications or the organs that can get affected by SLE?
Yeah, like I am suffering from this disease for the last 8 years, right? So my doctor, the rheumatologist who has been seeing me,
Hmm.
so she has already told that I may have got certain complications in some other organs. So yeah, I know a bit of it.
Okay. So, because of the because of the challenging you know uh, management for this type of condition, as you must be already aware, so as your report shows that your kidneys have actually reduced in size. That
Mm-hmm.
means your the normal functioning of your kidney has reduced. Now, all of us, how kidney function is that whatever we intake we are taking in our body, so kidney will remove the toxins and the other harmful products from the body via our urine, and that's how the balance is maintained in our body, so we don't fall sick,
Fine.
especially the electrolytes level, sodium potassium level.
Okay.
So what happens is that in your case, because of the disease per se, your kidneys are not functioning well. In fact, the report shows that the the filtration or the amount of urine that should be produced normally, and the function of excretion, that is removal of toxin, is greatly reduced in your case. And
Yeah, doctor,
to
I'm aware of that. My GP has already told me this.
okay, so the thing is that because of that you are feeling lethargy and all. So
I
in this situation, uh, only treatment available is something called uh, dialysis or transplant. Are you aware of them?
My GP has actually told that I may require dialysis. After that, I went and read it up, and I found that the disease I'm suffering from, this SLE.
Hmm.
So these patients often go become dialysis dependent. Ultimately, there was some mention about this transplant. So I shall like to know more about these options today.
Okay. So the thing is that in your case, because the kidneys have deteriorated far more than expected, so in dialysis, what we'll do, there will be a separate machine, and mostly you will require thrice weekly dialysis, where we'll create one channel in your hand, in your arms, so the through which we will circulate blood and a filtrate via that machine, so that the toxins that are supposed to be removed via your kidney, that function will be taken up by the dialysis machine. However,
Okay.
so that over your you don't develop the symptoms that or the problems that you are facing currently. So the issues of developing side effects for not for having damaged kidney will be reduced. But
Okay, doctor. So you told about something like there'll be a channel in my hands. So what's that about?
okay, so it's basically they'll create a fistula. Okay, it's a medical term. So
Okay.
basically you must be knowing that we put cannula to give saline and
Yeah,
all
yeah,
that.
that's what I'm asking about. I'm not asking how is it made. I'm asking that I know about these cannulas. These I have been admitted before because of the disease, and they are
Yes,
really painful. So this channel that we're talking about, through which the dialysis will be done, and you have already told the frequency of that, which is like alternate day, like right, 3 times a week.
right,
You already
right.
told. I was not aware of that. It will be that frequent. So, like, it will be very painful, right? The for getting that permanent thing in my hand.
Initially we have to create that channel. So initially it will be little painful when we are creating the channel, but we'll give anesthesia so that you don't get that much of pain when we are creating that channel. But on a alternate basis, when you will be coming and will be using that channel, so we can use some anesthetic agents, like some numbing agents on your channel, so that when we are putting a cannula, you don't feel that much of pain. Because as you are saying that you are hypersensitive to this cannula insertion, so we can use some numbing gel which will reduce the intensity of pain when we are putting the cannula through those channels. That is one way of doing it. But obviously the benefit that you will be getting via this dialysis will be far more than, the minor pain or the little prickly sensation that we'll have when we are putting the cannula.
Okay.
That is
Okay,
one thing.
I'm okay
Yeah.
with that.
Hmm.
So apart from that, like during this, as you told that the blood will be taken out and it will come back in my body again, right?
Right.
So yeah, so like, will not there be other problems associated with this?
Yes, for any intervention that we do on a human body, there will always be some complication. So in your case, when we are actually, taking out your body blood and we are passing through that machine, there will always be some chances, like, your BP dropping very low, or you are developing some rash, or some other
Mm.
side effects of this procedure.
So what are
So
those side effects? I want to know about that, because I already know the advantages that my kidneys are not working. So I shall require the dialysis. Otherwise, the kidneys will not work and the toxins will not go out. So what are
yes,
the side effects apart from
so
the what I have told?
yeah, so one of the side effects is your BP falling very low. So that's why you will be, these procedures are done in hospital setting, where you'll be constantly monitored when the dialysis is happening. And then some other side effects depend on the type of dialysis, which we can explain you later. The concerned doctor will explain. And also sometimes you can develop uh, the side effect of the medicines that are used in dialysis. For example, we use something called heparin. It is a type of blood thinner to prevent blood getting clotted when it is being circulated. So that also can, cause a a problem in your body. But we
Mm.
always make sure that we are alert, and, we at any given sign, we will stop the procedure and we'll first treat you, and then continue the procedure. So there is always backups available to deal with the situations that commonly arise via this uh, dialysis. But yeah, definitely there are few common things that we will be managing. Like if you develop hypertension, we may, give you some medicines to maintain your BP. If you develop heparin induced some low plated or something, then we can deal with that. So we will be managing the
Okay,
situations that
understood
arise
this.
during dialysis. Yeah.
So yeah, so understood it. So doctor, tell me something about this transplant option, because it seems that there are some side effects of this dialysis, right? So
Yes.
what if I opt for transplant? Can I directly opt for it, or is there anything else that needs to be done?
Okay. So the thing is that in your case, transplant is also a good option, because the daily dialysis, and given your your age, so rather than getting into lifelong dialysis, transplant is definitely a preferable option. But in your case, there is some additional problem compared to a normal patient, is that your problem, that is your SLE, this is a type of autoimmune condition. That means your body is producing antibodies, uh, or the products which are acting against your own body, that can also, cause harm when we are taking a kidney from someone else and putting on your body. Now you are already on drugs like hydrochlorochlorianol and mycophenolate mofetil, which
Mhm.
will anyways cause some some low immunity. It will reduce your immunity. So when we are transplanting, again we'll be anyways keeping your immunity low, on a lower side, so that your body doesn't react to the transplanted kidney. The antibodies of your body shouldn't react against the kidney, and it can thrive on your body, and it can take over the function of your damaged kidney. But in your case, this problem may be little more aggravated, given your body having the auto antibodies. Another thing is that after transplantation, I mean after the kidney transplantation, you will be put on a immunosuppression, as I'm telling you. And also, to get a kidney, so you'll be put on a waiting list, or there needs to be matching. There is something called HLA matching, so that a lot of procedures are there, after which only the HLA matched kidney can be accepted for any given individual. And it is time consuming procedure as well, because the getting a organ for transplant is not that easy given low awareness. So till you get a transplant, we can put you on the transplant list. We can continue our dialysis as as I mentioned. And then by the time you are selected, or you get a matched kidney, then we can think about the transplant.